in the African innovation space. You will be stunned at the number of things that Nigerians and indeed Africans are doing to make the life of everyone better. I am Chinatu Oji, and this is African Innovation Landscape, a program that spotlights Africans who are transforming communities using smart inventions. Recently, we were in Lagos, Nigeria, where we discovered an innovative healthcare system that takes quality and affordable healthcare services to the doorstep of Nigerians. We go on a quick break now. When we return, you'll find out more. Don't forget, this is Idea Television, the innovation TV of the century. Market doctor, what's the story?
Market doctors say what we want to do, what we typically want to achieve is just to make sure we create access to healthcare for everybody, every common person, the man walking on the streets. That's just our aim, is to create access to healthcare to the common man.
Okay. How long has this been running for?
So let me say, on paper, 7 years, but typically maybe 5 years. Yeah.
Wow. Such an innovation. Well done. So tell us about the beneficiaries. How many beneficiaries so far?
So if we're looking at the beneficiaries, this is 20,000 to 2024.
Oh, wow.
So we're looking at over 500,000 beneficiaries.
500.
And they're across 13 states in Nigeria. Across the different geopolitical zones. So we're looking at over 500,000 beneficiaries.
All right. So does this mean that Market Doctor is not just in Lagos? It's around different parts of Nigeria?
Yes, we're around different parts. There's actually nowhere that we're not in Nigeria. As long as you need a project in a particular location, we can actually do it. So our goal to create access to healthcare is not just for people in Lagos, it's across the country.
Okay. And has it been so far?
It's quite difficult, I must confess. It's quite difficult, but again, rewarding. Again, rewarding, because the work we do is the work that you see instant rewards. You see things happen instantly. The beneficiaries get it immediately. So you have a one-to-one contact with a lot of them. So it's quite rewarding.
All right. And so, it's quite rewarding, but then again, how has it been operating in Nigeria?
It's a difficult terrain to operate in Nigeria for anybody doing innovation. You're looking at the different aspects of regulation, you're looking at compliance. Sometimes your kind of innovation is not even on the Gazette, it's not anywhere. So even when you're trying to get into regulatory, they're looking for where you fit into, So it's quite challenging. And again, look at also government policies. Sometimes some things that are needed are not things you really need when you look at it. And especially in Market Doctors, which is a social enterprise, so some of the requirements means that you need to transfer a lot of costs to the beneficiaries, which they cannot afford, but for you to be compliant, you need to do a lot of all of these things. So that again affects, it affects the work. Then I can also relate to security challenges. You want to go to some parts of the country, you need to have security. That's an additional cost. That's an additional cost to the work we do. So sometimes we really have to reject going to some places, for security reasons. Then you're looking at infrastructure. When I mean infrastructure, I'm talking about roads. So we have mobile clinics, and we've run more than 8 mobile clinics. Sometimes the size of the mobile clinics cannot even get to the communities that we want to get to. Sometimes you park at a place, and you get the community to come and meet you there. So it's a lot of ups and downs, but we are meandering.
Yes, I like the fact that the dedication and commitment keeps the fire going. Maybe this is also why you've received a lot of accolades and awards, in this initiative, in driving this initiative. What's really been that story, these awards? How do you feel about them?
Okay, before I go to that, I also wanted to mention the human resource, which is a huge challenge. Healthcare workers are leaving the country in drones.
Sadly,
it's difficult for you to get healthcare workers. We've had to do a lot of capacity building. You keep on doing it because you get people, they leave, you get people, they leave. So that's also a big issue and challenge, you know, in the work we do. When it comes to the awards, I'll say I'm extremely grateful because sometimes you find that the work you're doing for local people, sometimes like as if the local people don't even appreciate it. And I'm being very honest. It's as if the local people do not even appreciate it. But people that look at you from the lens of the impact you're making are the ones, you know, giving you awards and telling you well done, saying kudos to you. And it's been a long, long journey. I think we've had so many, but notable ones to mention is the Cartier Fellowship, which is an international fellowship, and we were part of the Sub-Sahara Fellows. I mean, 3 fellows from Sub-Sahara Africa, and Market Doctors was actually able to make it. Looking at also the African Business Heroes, I think at some point we were top 50 nominated African Business Heroes, you know, in Africa. Looking at Vital Voices, which is a United Nations project, we were the first, I mean, the UN SDG Fellow, you understand? I mean, advancing the goals of the Sustainable Development Goals, especially in SDG 3, health, you know. And then again, we were also called, and we were labeled the goalkeeper for the Bill and Melinda Gates Foundation, where we went to present and speak about the work we do in advancing the SDG goals. So it's been a lot of, I mean, thankful for all of it. It encourages you, helps you to push on.
Yeah. I love that the groundbreaking work you're seeing is getting the accolades that you deserve, and I'm sure more will come. More will come. You know, you spoke about some of these challenges, and it's really true. But, you know, as a health personnel, what do you think that the governments in and even outside Nigeria, what do they need to do to ensure that these things are guarded against?
I think the top things I've mentioned is health workers or workers generally, what they need goes beyond remuneration. It goes beyond how much they are paid. There's a lot attached to it. People are thinking of their families. People are thinking of security. People are thinking of their quality of life. Let's even take, for example, electricity supply. You know, when you can't be sure if you're going to have electricity supply and you have to do a lot, that's even for our business, that affects us. And now at individual level, you're not having the quality of life you want to have. Sometimes if there's no electricity overnight, you cannot sleep well. Do you understand? That affects your productivity the next day. And I'm talking about adults. What about children? So people are really concerned about, beyond remuneration, people are really concerned about the quality of life they're living. People are concerned about the healthcare facilities that are available. If I fall ill, what happens to me? You know, so people are dying needless deaths. You know, and people don't want to be caught in that web. Ask a lot of people that live in the country. Everybody has one major reason. It can be a death of a loved one, and people will tell you, know, it is over. I'm not going to sit down and continue doing this. You know, so when you go to security, there are some places you can live. There are some places you can't live. You can't walk. You can't be out at some times in the night. You know, so it's a bundle of issues, which is different for each individual, you know. So I think what the government needs to do is to look beyond remuneration. They need to look in totality at the quality of life people are living. If people get good quality, at least an acceptable level of quality, I think a good number will stay for one reason or the other. You understand? Beyond remuneration. Then, of course, we still have to get to remuneration. The world is global now. People are comparing what they earn to what their counterparts in other countries earn. There is no way you can look at it that people will make such comparisons, and people are beginning to go for the greener pasture. So, I mean, all of these things have to be looked into. The quality of the training as well. I know things are changing, the curriculum, how diverse what you can do when you leave college, when you leave university. What are you armed with? How much can you do? So some people go because they desire to be in a particular field, and that field is not available in the country. They desire the training in that field is not available in the country. Some people are trained, they desire to do some procedures. The equipments are not available, and they feel they can do more. So people leave because they want to be more. They want to be the best version of themselves. And those are the things that propel people to leave.
Thank you very much. That was very insightful. When you spoke about some deaths that can be avoidable, I just remembered the story of someone I know. This man lost his wife because while the woman was in the theater, there was no more electricity. I mean, light went off. And in a hospital, they went to check the fuel in the generator. There was no fuel too. And that was it. Somehow they lost the woman. And I'm very sure that if that man has a chance to leave Nigeria, he'll not think twice, because that will be a constant reminder. And so what you just said is that our government needs to do more because the people now yearn for more. Yeah. All right. Thank you so much. What do you think makes mobile market doctors stand out? What's very unique about market doctors?
Yeah. What makes market doctors stand out? The service we render. You know, typically people feel that when people render service to the informal sector, to the underserved communities, that the quality of the service has to be lower than what is being offered at, you know, big hospitals and all of that. But no, the quality of service we offer is as good as what anybody can get. You understand? Because we have partnerships. We have the kind of medications we use. We use qualified staff. In fact, we are so detailed in all of that, that if someone said that they got a malaria medication from market doctor, we can tell what the medication was. Wow. That is how far we've gone in our quality assurance. If someone said, oh, I saw market doctors at this market and I was diagnosed for this and this was the medication I was given, we can tell the particular medication, the brand that was given, because we do a lot of, everything is done from a central system so that the quality delivered at every location is good. We also make sure that the commodities that are available for our clients are commodities that gives them an array of choice. You see, there's something called dignity in when you want to give someone who is not too rich a drug, a treatment, or a commodity. The fact that the person is poor or the person is not very rich doesn't mean that you give anything to the person. So we are very big on dignity and how we give the care. So we don't treat our people anyhow. We don't reduce the quality of care we give them. We don't reduce the quality of the medications they get. What they get is what can be compared to what can be gotten anywhere, despite the fact that we're giving it in the market. Now, the other thing that I would say is very unique about us is that we're one of the only people in Nigeria taking healthcare to people. Oh. People usually come to healthcare. We are taking healthcare to people. And when you take healthcare to people, what have you done? You've removed the hidden costs of healthcare. Remember, the kind of people we deal with are people that earn daily income. So it means if they don't go to work today, they're not going to earn income for that day. So it means if they have to access healthcare by going to an hospital or traveling to another village or something to get healthcare, it means that day they are not going to make income. So add that cost to the cost of what they spend. So they're going to be more impoverished. And that is what we're avoiding. We're saying that people do not need to lose man-hour time, and they do not need to lose income just because they want to seek healthcare. So we take healthcare to them. The other thing is that we're very culturally sensitive. Okay. Some people, the white coat is even a problem for them. You know, they see the white coat, their blood pressure gets higher. They feel, I'm seeing a doctor, I don't know how much the doctor is going to charge me and all of that. We're very culturally sensitive. Per location, we speak the language. Oh, I was going to ask we speak the language. We don't need to diagnose something, you don't need to speak English. You can speak Pidgin, you can speak the local language, so that you can really get out the real symptoms, you know, from it. So for us, you know, we're very cultural sensitive. In locations where healthcare has to be delivered woman to woman, man to man, because in some locations you can't deliver man to woman, and that is an obvious barrier, you know. So I think those quite a lot of things that make us unique, but I've just tried to highlight the few that I can talk about. We work with the community people, so we have like teams that we activate when we need to go to communities. So we work with people in the community, because that is also part of how people accept your services. When you are strangers, do you understand, to them, they feel like, oh, we don't need these people. And you need to get their trust first before they can even listen to you, tell you their problems and all of that. So we always do it within the community, for the community. So it's a local solution for wherever we go.
Okay. Well, you know, when you were speaking, you spoke about the fact that Market Doctor is pocket friendly. I wanted to emphasize on that.
So it's pocket friendly, one, in that indirect way. You're not going to spend money to see us. We're going to be at your location. So your transport money is already gone. And we know that now, with the cost of fuel, transportation is a major cost in everybody's lives. Anything that takes transportation away from you has already reduced your cost by almost 25%. By almost 25%. The average that someone spends with us is maybe like 3,000, 4,000, depending on the problem you have. But we know that we also attack primary problems, because we believe that a lot of people, what they need in the healthcare space is really small. If they get this care early, adequate, you understand, then they won't need to go to the tertiary centers. Then they won't need the big surgeries. Then they won't need the admissions. So beyond giving curable care, we do a lot of preventive and promotive health. A lot of preventive and promotive health. And we're very current with what is going on. So if cholera is going on, we jump on it to do a lot of health education, promotive care, how you can prevent it. This is what you need. We jump on it. If it's another thing, we jump on it. You know, so we look at the communities, we look at what is happening, and that is our basis for all we do. So we believe that everybody needs a degree of primary health care, you know. And we've seen there's this campaign going on now, Know Your Numbers and all of that. We've done that over 5 years. That is what we've always done. I mean, you see someone, you want the person to know what are the basics of your survival, your blood pressure, your blood sugar, you know, your blood pressure, your blood sugar, your weight, your height, your BMI. And as you uncover these numbers, you're educating them. Oh, is it high? Is it low? Then they begin to tell you one or two things about themselves. You know, then they begin to also demand for the kind of care they want. And some of them, oh, I've had this lump in my neck. I've never known what it's about. That is where you uncover it. And you can refer them to where to go. Because that is also a critical service, referral service, telling people where exactly to go. So they're not, you know, something that you need to see a gynecologist for. You are not first going to a general surgeon, because that is also wastage, you know. So that referral is also a big thing that a lot of people do not know. So those of us that have friends that are doctors, nurses, we live in the big cities, we take a lot of those things for granted. But, you know, for these other people who do not even have a doctor as a friend or a nurse as a friend, they don't have any phone number of any of those people. They rely on what people around just tell them. Yeah.
And that's how they start patronizing quacks.
And that from there it leads to more serious health problems.
True. Okay. I mean, I know that you're very focused on rural communities, but how about the people on the other end? Do people have access to your services online too? So can I call now that it's challenge immediately, and then there's somebody attending to me?
Yeah, so my friends patronize my business. My friends buy medications. My friends come to our clinic for checkups. My friends, you understand, people bring their children, people that are in the same, maybe let me use the word class, as we are, who are not even informal sector, they come. So like I said, the fact that we're focused on that sector doesn't mean that our services are low quality. It doesn't mean that our services are low quality. And if you check out our partners, you'll know that there are people that will not go below the line. They will not go below the line, and we've proved that constantly over more than 5 years.
It has to be quality over quantity. Okay, now that we've spoken about partners, how has the support been in Nigeria? Are you getting any kind of support from Nigeria? Why is it?
So we have support. I won't say, but we can do with more.
Okay.
But we have support, and I want to really thank the organizations that have supported us over the years. We are very careful with the kind of partners we also choose, and we want partners that have empathy. We want partners that are people-centered, community-centered. We want partners that are not looking for what is in it for them. Some partners give health care but want something back.
Oh, yeah.
Do you understand? So we're very careful in our choice of partners, because we also explain our philosophies to them. So we're in the heart of community, in the heart of empowerment, and in the heart of long-term partnerships. So we hardly see partners that come once and do not come again. Our partners have been there. I wouldn't want to mention names, but I mean, they've been there consistently, some over 5 years, some over 4 years, some over 3 years. So we've had partners who are, and they choose the area of interest. Some are interested in malaria, some are interested in diabetes, some are interested in maternal health. They have their areas of interest, and we work with that, and they're able to reach the heart of communities, by partnering with us. A good thing about partnering with us is that, you get your message right to the beneficiary. There's no intermediary in between. Whatever impact gets right to the beneficiaries. And I will also say that even our partners have received awards based on the work we've done for them.
Oh, wow.
Yeah.
That's
based
impressive.
on the work we've done for them.
Okay. Oh, wow. So on a final note now, what would you have, what are your final thoughts on Market Doctor, or even on the healthcare terrain in Nigeria?
Looking at where Market Doctors is going, and I know Market Doctors is a solution for a lot of the problems in healthcare. A lot of the pathways for accessing healthcare in Nigeria is getting outdated. It needs to be revamped. Things have changed. People are more global. People are more on the move. People do not have the kind of time our parents had when they returned to work from 3:30, then in the evening they want to take children to the hospital. People don't have that kind of time again. Do you understand? People are on the move almost 24 hours. So people need something they can get on the move. You have to meet people where they are. And that is what we're saying. We want to take healthcare to people where they are. We want to put healthcare in people's shopping bags. That when you come to the market, you buy pepper, you buy groundnuts, you buy oil, you make your hair, then you come in for a health screening. And you do all of those things together and you go home. So we really want to put healthcare in people's shopping bags along the way as they go. Pick it and go, move along.
I mean, I can already feel it. It was such a rewarding session with you, Dr. Yetunde. Thank you for having us.
Thank you so much.
Thank you so much. And to you, our viewers, you heard right from the horse's mouth, Dr. Yetunde, the MD of Market Doctor, taking healthcare right to your doorstep where you need it, on the go, on the move. This is Idea Television, the first innovation TV in Africa, and our work is to promote inventions and innovative initiatives like what Market Doctor is doing. Keep a date with us until next time. Do not forget to follow us on all our social media platforms to stay updated. Thank you so much.